Story 1. Sleep apnea. I didn't get a continuous positive airway pressure machine, or CPAP, until about 8 years after being diagnosed. Eventually, I had no choice when I couldn't take a 15-minute drive without falling asleep at the wheel. One night coming home, I ran off the road and woke up just in time to drive through the neighbor's garbage cans. I had a CPAP within a week. Completely changed my life. Night and day difference.
Sleep apnea can have catastrophic effects on the body that people may not expect. I had a sleep study not because I suspected sleep apnea, but because I had a deep vein thrombosis, or DVT, in my leg that led to multiple pulmonary emboli, or blood clots, in both lungs. My consultant said my extremely low oxygen levels night after night resulted in my blood becoming thick and sticky, causing the clots. A scan of my legs showed a history of DVTs that my veins had somehow sealed off or bypassed in the past, but they're still there. The sleep study revealed I stopped breathing on average 83 times an hour, or about 700 times a night. My consultant said there were around 40 times a night. He could not believe I managed to start breathing again. My oxygen dipped to 70%. Even though my consultant said my sleep apnea was one of the worst cases he'd seen, the only symptom on the list that I recognized was how loudly I snored. I was unaware I stopped breathing 700 times a night. I got a continuous positive airway pressure, or CPAP, machine, which changed my life for the better in so many ways, and it may well have saved it. And after a few months on CPAP, all sorts of persistent ailments healed. I've since had my weight, maintained a healthy weight for 2 years, and no longer need CPAP as my sleep apnea has gone completely. I'll be on blood thinners for life, though.
Same here. I've been dealing with chronic fatigue and some weird neurological symptoms for a few years. But after having a bunch of stuff ruled out, I gave up on it, thinking it was me/CFS, myalgic encephalomyelitis/chronic fatigue syndrome, or something similar. Sometimes I needed a cane to help with balance when walking. I had to cut back my work hours. Then I started getting super dizzy, so I just showed up at my nearest clinic, and they found that my blood pressure was 210/147, 210/147. I got on blood pressure medications, which helped slightly, but it was only when I mentioned a drowning sensation when falling asleep that something clicked. The doc arranged for a sleep study, and it came back with an AHI of 30, the apnea-hypopnea index. I got my CPAP, continuous positive airway pressure, a few weeks later, and all my weird issues just disappeared. It was like magic.
Oh, dude, I had so many little things changing health-wise that I'd just been assuming. Welp, I guess I finally reached the age where this starts happening. Like, one example was I was constantly up and down throughout the night taking a piss. And it all just turned off like a light switch as soon as I started the CPAP, continuous positive airway pressure. If anyone is reading this, if you feel lethargic throughout the day, if you come home and something simple like sitting down to watch a little TV just puts you instantly to sleep without you having any control, and honestly, even if you're just a snorer, you most likely have sleep apnea. Go get a sleep study done.
Story 2. I'd get sporadic abdominal pains in the middle of the night, but they'd usually pass by late morning, so I didn't think they were serious. Turns out it was gallbladder attacks. Relieved, now I have medication to dissolve the stones, and I was needlessly in pain for 2 years.
I had the same thing one autumn. I'd wake up about once a week with an ache. I couldn't understand what it was, and on Christmas night it got so bad that my fiancée at the time called an ambulance. When the EMTs, emergency medical technicians, came, I crawled out from my fetal position on the sofa. They looked at me and suggested I should go to the hospital by myself, driving there. My fiancée couldn't drive me, as she had to stay home and take care of our toddlers who were sleeping. I told them I wasn't fit to drive, and they said I could stand, so maybe it wasn't so bad. Could I take the bus? In the end, they drove me to the hospital, but I was so out of it, I don't remember much. I got diagnosed with gallstones and had my gallbladder removed.
Same here, and I've had some horrific breaks. The agony of the waves of cramping was like nothing I've ever experienced. I just collapsed, doubled over in public one time, and got rushed to the hospital. Another couple of times, I drove myself to the hospital in the middle of the night and would pull over when the ultra-intense waves came. It took 6 trips to the emergency room for them to figure out it was gallstones. They whipped out my gallbladder, and I've been fine since. Definitely a 10 out of 10 pain for me.
Sometimes the damage is so bad they opt to remove the entire organ. I let mine go on for over 3 years. Those attacks brought on by eating the wrong food. Every meal was like Russian roulette. I still refuse to eat baked chicken because of the pain it used to bring me. Were so awful. Some of the worst pain I've ever felt, besides giving birth with no epidural. By the time I finally went to the emergency room, my skin was yellow from acute pancreatitis. I look back on pictures from back then and notice how yellow I used to be, and I didn't even notice it back then. They did a procedure to sweep the stones out of the duct, but the damage to the gallbladder was too extensive for it to remain in my body. I had it removed, and now relieved, I don't have to worry about being in excruciating pain for hours from eating a single Dorito.
Story 3, back pain. I was told it's because I sit too much. Turns out it was a spinal tumor.
I was in a lot of pain, and then I had a baby. I couldn't live like that anymore, so I begged for MRI. They weren't even meant to be scanning the tumor location, but they accidentally did and found it. It's not removable, so it's just a race between the tumor paralyzing me or something else killing me.
I believe mine came from possibly fracturing my tailbone as a kid when I slipped on ice during recess. It healed incorrectly. I couldn't sit without pain for weeks. As I got older, the pain gradually got worse. I'm now 8 months pregnant, in my early 30s, and the tailbone pain is excruciating. I did some reading and talked with my obstetrician gynecologist, and it kind of clicked. I think it's the cause of all my pelvic floor problems, from pain during sex, to menstrual pain, to constipation, to my lower back feeling like it locks in place if I stand or sit for too long. I used to ice skate for exercise, but had to stop a few years ago because the lowest portion of my back would lock up after about 15 minutes on the ice. It only went away after taking ibuprofen and lying on my side with a heating pad for a few hours. At this point, after some 25 years of this, the only real fix is surgically removing the tailbone. Maybe next year, after I give birth. Unless, of course, it breaks during childbirth. How fun that would be.
Maybe next year, after I give birth. Unless, of course, it breaks during childbirth. How fun that would be. Chuckles. Maybe you could schedule a cesarean section and get a 2-for-1. 1 baby and 1 tailbone removed. 1 bill. Seriously though, that really sucks. I hope you get that tailbone sorted out. And I'm not actually advocating for a cesarean section and tailbone surgery at the same time.
Story 4, blood when pooping. I chalked it up to hemorrhoids as it runs in my family and I'd had kids. By the time someone looked at it, it was stage 3 cancer. Gone now, but man, was it a pain in the ass.
My first colonoscopy was at age 54. I had a polyp that was about to become cancerous. It was too big to remove with the scope, but they were able to get the precancerous part. 2 months later, I had another one, and they still couldn't get all. 2 months after that, I had surgery to remove 6 inches of my colon, but they hadn't marked the spot. The surgeon couldn't feel it, so he took out 24 inches to make sure he got it. I'm fine now, but I get scoped every 3 years.
Piggybacking on this, as I ended up in the emergency room on Saturday due to severe lower gastrointestinal bleeding. Get your rectal bleeding checked out. I'm currently awaiting further investigations, and my mind is spiraling.
It happened exactly to my mother-in-law, except it was stage 4 when they finally caught it. But she is a damn lucky lady who beat 5% odds and has been in remission for 7 years now. Still, she's the exception, not the norm.
Story 5. I put off having a skin check at a dermatologist for a few years after noticing a new and itchy mole on my shoulder blade, as well as a mark that looked like acne on my shoulder that wouldn't heal. I finally made myself the appointment this past May, had a few spots removed and biopsied, and 2 of them turned out to be basal cell carcinoma. It was a huge pain because I couldn't reach the bandage on my shoulder blade to change it, and the dermatologist had to dig pretty deep to remove it all, so it was painful and constantly super itchy once it healed. I had to go back and get an injection to stop the itching. So get your skin checked, especially if you're fair-skinned and have freckles.
I had a mole that would bleed for a month, heal, disappear for 6 weeks, then pop back up. When I went to the dermatologist, she said she wasn't concerned but her supervisor offered to biopsy it just to be sure. Basal cell carcinoma. She made me feel like an idiot for the 2 days it took for pathology to come back.
Please go. My mom had a mole that changed color. She went to the doctor, and it was dismissed as nothing serious. A year down the line, she was diagnosed with malignant melanoma that had spread to her brain and lungs. She died 6 weeks after diagnosis. I'm not saying this will happen to you, but get it checked out and don't let yourself be fobbed off.
I had a large freckle on my face, hidden in my hair above my ear for 40 years. Finally, I decided to get my general practitioner to give me a referral to a dermatologist. I had her do a full body check. She froze off some precancerous spots and removed my freckle for testing. It came back as melanoma stage 0, in situ. Happy dermatologist. She had the surgeon take off 5 millimeters of skin surrounding where the freckle had been. That test came back negative. So yeah, now I just wonder when it went bad. Mr. Freckle was large, about 7 millimeters long and 4 to 5 millimeters wide at its widest point, non-symmetrical, and had irregular borders.
Story 6. I was tired and had stiff, painful hands. I figured it was because at the time I was a full-time caregiver for my very sick child for a full year. I had no energy left to deal with it, so I ignored it. My kid recovered, but my hands kept getting worse. My shoulders and back started hurting too, and I could barely function. So I went to the doctor. Rheumatoid arthritis. 31. I got extremely lucky that it hadn't damaged my bones yet, and I'm slowly getting better with medication. I'm 32 now, still in pain and on sick leave at home, but it's better than it was.
Now, I'm starting to think I have this. I've always had joint problems since I was a kid, but doctors kept putting me off, saying they were growing pains. Now I'm 20, and I still have the same problems, but worse. My knees hurt so bad I can't keep them bent for long.
No, actually. The first step is simply to get a blood sample and check it for inflammation. After that, I was sent to a rheumatologist who checked me for symptoms like swelling, pain, limited mobility, and bone damage, and did another blood test looking for more specific markers. These were negative for me, which apparently can happen even if you do have arthritis. Then it's starting medication and seeing what works.
Seronegative rheumatoid arthritis. About 20% of people with rheumatoid arthritis have no markers. I got in an argument with a rheumatology fellow who told me I had bilateral carpal tunnel syndrome causing the same symptoms in my hands, but couldn't explain the extreme pain I had in both feet. The second rheumatologist didn't even bat an eye at a rheumatoid arthritis diagnosis when I described my symptoms.
Story 7. I had a weird sensation, like water was dripping down the back of my leg. I ignored it for several months, and then I started noticing occasional tingling in my feet when I bent over to pick something up off the ground. Just a couple of months later, I wound up essentially paralyzed. I couldn't feel from the neck down and couldn't use my legs. I have a severe vitamin B1 deficiency that causes a condition called beriberi. I spent a year and a half in a wheelchair, not able to walk at all. I'm 3 years out now and still need a cane because of the nerve damage in my left foot.
I have peripheral neuropathy, and I try to tell my doctor that my hands have no grip strength when I wake up and sometimes randomly throughout the day. I didn't ignore it until she completely dismissed me. Also, vitamin B. Seeking medical help as a woman is almost always a dead end.
Same here. I've been complaining about my hands tingling for about 6 or 7 years. Finally, I gave up with that doctor and went somewhere else for other issues. The first thing they said when they saw all my old test results was, "And so, how is managing your diabetes going?" It literally happened today, and I'm still in shock.
Holy hell, you had beriberi? That's nuts. Can I ask what caused the deficiency?
Story 8. Not me, but my grandma. After going through menopause, she decided she didn't need to go to a gynecologist anymore. 10 years later, she started having some pain in the uterus region. She still didn't go. She started self-medicating like always. 2 years later, she occasionally had slightly bloody discharge. She still didn't go. My mom started urging her to visit the gynecologist. Took some convincing, but she finally went. The doctor took one look and instantly told her there was an issue. She needed a biopsy. She got that done and voila, it was cancer. She was booked for a hysterectomy or something similar, but when they opened her up, the cancer was everywhere. So they stitched her up again and told her she needed some other treatment. 2 weeks later, she was dead. This was preventable if she had gone to her yearly checkups. Don't be like my grandma. Get all your checkups done.
I'm being told it's now 5 years between gynecologist visits after menopause. Unless, of course, shit happens.
Saw a patient today who had an abnormal pap smear 20 years ago and hasn't seen a gynecologist since. She's now got stage 4 cervical cancer and a pretty grim prognosis at age 43. It's really sad.
Something similar happened to my aunt. She had continual stomach issues for years that no one could figure out. She kept going to her doctor and trying different doctors too. She finally got a scan and all of her organs were cancerous. She died a week later.
Story 9, renal failure. I had been living in Florida for a few years and went back to the Northwest for 2 months. I thought I had altitude sickness. When I went to get checked, I could only walk about 50 feet before needing a break, and my tongue was white. They took my blood pressure in the emergency department, and it was 320 over 290. I became very popular, and the nurse told me not to move. They opened a blood pressure pill under my tongue, picked me up, and laid me down on a gurney. Turns out I was in advanced renal failure. I needed a blood transfusion and was put into surgery for a chest catheter for dialysis. I spent a week in the hospital before I could leave. After the doctor saw my blood work, he was surprised I was lucid or even alive. He said I should have had a stroke and that my blood work was what you would see postmortem for renal failure. I still have memory problems 20 years later.
Yeah, I knew from the nurse's reaction it wasn't good, and it hurt really badly when the machine was taking my blood pressure. I tried to stand up to get on the gurney. She yelled at me, then apologized and said, "Please, just let us do it." After they put me on the gurney, she told me I should have already had a stroke or an aneurysm.
I've seen some wild stuff in 15 years in the intensive care unit. I'd say the highest blood pressure I've ever seen is around 280. The fact that you didn't have a stroke is completely insane.
The first few days in the hospital, as soon as they hooked me up to the machine, it would make me fall asleep like I was sedated. Once in the hospital, after my first treatment and transfusion, I finally felt how sick I truly was. They only gave me 2 units of blood because the doctor was worried about making my blood too unique, which might hurt my chances for a transplant. My blood count was 4 before the first transfusion. They then used iron and Neupogen to help raise my blood count and fight infection. All of my levels were crazy. My BUN ratio, creatinine, red cells, white cells, albumin, protein, and so on. I did have uremic frost and uremic stomatitis. Chunks the size of dimes from my tongue were coming off.
Story 10. I suppose this sort of applies, but I started having awful stomach problems around age 7 or so. I was taking so much Pepto-Bismol, I don't know how my parents didn't notice how quickly we ran out. For some reason, my 7-year-old brain told me to hide it, so I didn't bother anyone with my issues. I got diagnosed with Crohn's disease at age 13 after being accused of having an eating disorder by my dad, who, even though he is Crohn's himself, thought I was not eating on purpose. I too often wonder how things could have been different if I had just told my parents when it started. My disease has been severe and never fully under control, and I've been living with it for over 17 years now. So to anyone reading this, please, if something feels wrong, just go to a doctor and get it checked out.
For what it's worth, I did tell my parents, teachers, doctors, specialists, and the therapist they sent me for anxiety. It took 16 years for anyone to actually look and go, "Oh shit, how did you go this long without symptoms?" Like, no, I've had symptoms this whole time. Thank you.
I was misdiagnosed for years with irritable bowel syndrome and a sensitive stomach. I have a family history of Crohn's disease and autoimmune issues. I was just a teenage girl with anxiety. Eventually, freshman year of college, I lost 30 pounds in a month and ended up in the emergency room and was finally diagnosed. I've ended up with tumor necrosis, factor blocker-induced autoimmune hepatitis, lupus, and now rheumatoid arthritis. I've had a lot of trouble getting my immune system controlled and wish I got diagnosed earlier.
A similar thing happened to me. I was diagnosed with Crohn's at 13 as well. Prior to that, I had some obvious symptoms, but my parents treated them by restricting the foods I was allowed to eat and taking me to naturopaths, witch doctors, and alternative medicine, expensive BS, before they caved and took me to a real doctor. Fortunately, it was soon enough that medication sent me right into remission, but man, I still wonder why they took such a long way around to get there. Especially because one of my parents is a freaking pharmacist.
Story 11. My husband got sick last year. He had fevers and flu symptoms. He rested and hydrated. Our toddlers and I had influenza a couple of weeks before that, so we figured he got something too. He said his back was really sore, so we rubbed on some deep heat and did all the things. He rallied for our 4-year-old's party, but he was not great. The next day, he started a new job in the city, and I was there. I saw him at lunch, and he was white as a sheet. He couldn't breathe properly and was drinking so much, but he was so dry. I took him to the hospital that night. X-rays and blood tests showed severe double pneumonia and acute renal failure. He spent 10 days in the hospital and then another 7 at home with a PICC line of antibiotics. That's a peripherally inserted central catheter line. He nearly died, and they had given him only a 33% chance of survival, apparently, but we only found out later. He was an otherwise healthy 37-year-old. The doctor said it was just bad luck. They were even looking for cancer and were so confused. I am still traumatized about nearly losing him, and I'm so on edge if he's sick now. He can't remember a lot of it, but I'll never forget.
My husband had an acute pancreatitis attack about 3 months before our wedding. I knew something was wrong when he hadn't eaten in a while and wasn't hungry. I was traumatized for a while about his health. I'd be a wreck to go through what you did.
I am so sorry. That is rough, but I'm glad he's okay now. During the height of COVID, it made its rounds at our house and hit my husband the worst. He just wasn't getting any better after a week or so and started to have a hard time breathing. I found him in the bathtub, just gasping for air, and rushed him to urgent care. They said it would be a 2-hour wait, and you had to stay in your car. My husband just wanted to go home and couldn't think straight. He was in no state to drive, but I took the keys anyway and said we were staying until he was seen. When we finally got in, they said he had the worst lungs of the day. He had double pneumonia, but thankfully it was bacterial and treatable with antibiotics. I spent the next few days by his side, constantly checking his oxygen and making sure he could breathe. I really thought I was going to lose him, and it was awful.
I have a very similar story with my husband. He was 34 at the time. He suddenly started having horrible stomach pains that wouldn't go away, so we took him to the emergency room. Diagnosed with diverticulitis, given antibiotics, sent home. Better in 3 days. Second bout of diverticulitis. Back to the emergency room. Same horrible pain. Antibiotics again, a 10-day dose. He took it day by day, but wasn't getting even slightly better. Somehow worse each day. Neither of us are doctors, so we kept holding out hope that one more day of antibiotics would turn the corner and he'd feel better. Day 8. I'm like, if you don't feel better by tomorrow morning, you should go back to the hospital. Lo and behold, day 9. He's feeling awful. So much pain, pale, can't eat. Back to the emergency room. Abscess the size of a softball in his intestine. The antibiotics didn't kill that particular bacteria. He just kept getting sicker. A huge abscess growing inside him, and we had no idea. After admission, vomiting so badly they had to insert a nasogastric tube. If you don't know what that is, you're lucky, and he finally got some relief. Then emergency surgery, and so much fear he wouldn't make it. He's great now, thank God. Relieved, but I've never been so afraid in my life. I really didn't know if he was going to be okay.
Story 12. A tooth infection. It was a little pocket infection deep around the roots of one of my teeth. I had far too much going on in my life to do much about it, and all I wanted to do was go home and sleep. I ignored it until I began suffering from pangs of pain and flutters in my chest. I ended up getting 2 EKGs and having my blood drawn before I realized what the issue was. Now I have medical debt that I pay every month, all because of this stinking tooth.
My mother-in-law almost died because of an infected tooth. She had a procedure, and weeks later, she started losing consciousness and went into sepsis. It caused blood clots in her heart or something like that, and those traveled to her brain, mini strokes. She was in the intensive care unit for 2 months, and for the first month, they couldn't figure out why she was in sepsis. It turned out to be a root canal infection.
That shit is serious and cannot be neglected because it absolutely will lead to sepsis. I'm sorry about your mother-in-law and glad she's okay. I left my tooth infection untreated for a long time, and I lost my damn mind. I tried to kill myself, not because of the pain. I had a lot going on in my personal life and was abusing drugs. The suicide attempt was actually a blessing in disguise. If I hadn't attempted suicide, then I would have died from sepsis, haha. I had no idea I had it until I wound up in the emergency room from overdosing, and the nurse said it was good I came in because I was really sick with sepsis and COVID. I looked it up, and sepsis symptoms include psychosis, which I was definitely suffering from. Every time someone in my life complains of toothaches, I tell them that story and beg them to go get antibiotics so sepsis doesn't creep up on them and wreak havoc on their mind and body, potentially killing them. They call it the silent killer, by the way.
My father had an infection in one of his lungs that almost killed him. It came from an abscessed tooth. The bacteria traveled to his lung, and he, of course, ignored it for way too long. He ended up in the hospital for 2 weeks on intravenous antibiotics, and they inserted a tube to drain his lung. They couldn't figure out where it came from until I remembered the abscessed tooth he had months earlier.
Story 13. Psoriasis. One day it was just a couple of small, mildly itchy dry patches. Then all of a sudden, the entire upper half of my body was neon red and itched like chickenpox's sadistic cousin. I didn't sleep for 6 days before getting my friend to take me to urgent care. The doctor walked in, eyes bulging, and said, "Oh my God, it's never ideal to shock the medical professionals."
I made a doctor go white as a sheet twice in my life. Once was a cat bite that turned into blood poisoning, but the other was a vaginal psoriasis flare the day after I had sex. The OBGYN was white as a sheet, started trying to explain things, and I was just like, take a breath, let me get out of the stirrups for this conversation. It was the only time I've known a doctor to offer pain relief without me asking for pain management. But I've been having the problems so long, it didn't even occur to me that anyone would consider the pain worth managing. Turns out having several labia tears was enough to shock at least one doctor.
Steroid shot for immediate itch relief and a topical steroid that healed most of the scaling in about a week. My doctor wants to put me on a protein-blocking injection medication that should work better because topical options can't be used on eyelids, but I have to get tested for tuberculosis first because it messes with your immune system. And for anyone wondering why I let it get that bad before seeing a doctor, I didn't. I saw the first of many doctors years ago when it was just a silver dollar-sized patch on my arm every once in a while. The first doctor barely glanced at it, then told me there's no cure or effective treatment other than moisturizing. Then this toddler doctor explained to a 30-something-year-old woman how to apply body lotion, which was so infantilizing it filled me with murderous rage. The next one told me there's no long-term treatment and said without evidence that it was almost certainly caused by my attention deficit disorder medications, so I should just stop taking those, said offhand like those drugs aren't necessary for functioning. After maybe half a dozen more tries with different doctors, never a dermatologist because United States healthcare sucks, I just kind of gave up hope until it was unignorable.
Sometimes not super amusing. Getting my wisdom teeth out was my first experience with general anesthesia. I wasn't particularly nervous beforehand, but as soon as they gave me the injection, my heart started racing like I'd just lost a triathlon. The last thing I heard before going under was one nurse saying to the other, "What's wrong?" "Oh no, that's not good." Like, come on girl, now's a great time to lie and act like everything's peachy. Chuckles.
Story 14. Kidney stones. I was drinking a lot of soda and eating terribly. I woke up one morning with a constant pain in my side. It started off uncomfortable, then gradually intensified to the point where I had to lie on my living room floor. I had to get rushed to the hospital, where they found out it was kidney stones that I couldn't pass. They gave me some kind of intravenous medication that immediately brought relief. I don't drink soda to this day. That pain sticks with me mentally. Worst pain I've ever experienced.
Yeah, mine was small enough to pass, but oh my God, it was the worst pain of my life. And now, 2 years later, I have another one forming. They gave me pain meds to keep on hand to use in case it starts to try to pass.
Kidney stones. I was drinking a lot of soda and eating terribly. I woke up one morning with constant pain in my side. It started off uncomfortable, then gradually intensified to the point I had to lie on my living room floor. I have a story for you. Back in the mid-2000s, I was around 29 years old with the metabolism of a hummingbird. I couldn't put on weight, and I smoked Marlboro Reds. I joined some coworkers doing a Navy SEAL training regimen around week 6. I started drinking 2 20-ounce protein shakes a day with whole milk, a 3 or 4 egg omelet in the morning, a double quarter-pounder supersized from McDonald's for lunch, and a big dinner. About 6 weeks of that, and I woke up in the middle of the night around 1 a.m., feeling like I was being slowly stabbed in my lower side. I had to hold my breath through each bout of pain. It lasted about an hour, then went away. I fell back asleep, only to wake up around 4 a.m., with it back with a vengeance. I struggled for about 30 minutes, then decided I needed to go to the emergency room and drove myself there. They did an x-ray, and the doctor came in and said, "Yeah, you've got a very large kidney stone that doesn't seem to be getting past your kidney. Here's some oxycodone and Percocet. Go home. When it passes, it'll be painful. Take the next couple days off. It should pass by the end of the week. If it doesn't, you'll need surgery." It never passed, and the pain never really came back. But I had outpatient surgery to break up the kidney stone with sound waves, which did the trick. I haven't had another one since. Knocks on wood. Yeah, that sucked.
I used to know someone who got kidney stones multiple times, like in less than a year. It was because she didn't drink enough water. I don't know what she was drinking instead, but she knew the risk, and she still let it happen because she didn't like water. She ended up in the hospital multiple times for it, in a lot of pain. Make it make sense.
Story 15. Light blood spotting exactly 2 weeks after my period ended. I thought, that's weird. Maybe it's ovulation or stress. But I ignored it. About 2 weeks after that, suddenly big pain. It turns out it was a ruptured ectopic pregnancy. Even though I insisted at the emergency room, there was no chance I could be pregnant because I'd had a normal period.
The problem is that irregular bleeding can be nothing. I had irregular bleeding my whole life, and doctors were just like, yeah, that happens sometimes. Periods started getting worse in my 40s, and then I couldn't pee. I had to go to the emergency room for a catheter. They did an MRI scan, and I had massive fibroids blocking my bladder. I had to have an open abdominal hysterectomy. My uterus was the size of a football. Anyway, fun being a girl.
Even though I insisted at the emergency room that there was no chance I could be pregnant because I'd had a normal period. And this is exactly why doctors always ask and do pregnancy tests, because people don't understand the word could. If you are sexually active and are a woman with a uterus, you could be pregnant.
Story 16. I was a foolish 19-year-old young man, ignoring what my body was telling me for about 6 weeks. It was testicular cancer that had spread far and wide. The hospital admission form came with instructions. Sign this or die next week, probably by Tuesday, definitely by Thursday.
Yeah, it was 40 years ago. The following 4 months were a wild ride of chemotherapy, a lung abscess, and an 8-hour surgery to chop the residual connective tissue and gristle out of my guts, so they could check that all the cancer was gone. Chemotherapy-induced hearing loss was a bit of a downer for 13 years, until hearing aid technology caught up. Overall rating, 1 star. Fucking get checked in week 2 rather than week 6 or so.
The original site was an undescended testicle, so there was no outward sign that anything was amiss. Tiredness, night sweats, and indeterminate abdominal pain as the large secondary tumor squeezed things around while it grew.
I knew a guy who had testicular cancer and had no idea until he passed out in the shower. Turns out, while washing, he turned in a way that caused the tumor to press on his femoral artery and cut off his blood supply momentarily, which caused him to faint. Had it not happened, he may have gone much longer not knowing.
Story 17. Teeth. Everything was fine for a few decades, but unbeknownst to me, the cavities were growing beside the gums and didn't hurt at all. I didn't feel the need for a regular checkup. About 40 dentist appointments in 3 years, a few implants, and now I need to wear a bite guard every night for the rest of my life. Take care of your teeth, yo.
I was really bad about flossing and only decent at brushing. Then in my 20s, I heard the phrase, only floss the ones you want to keep, and for some reason, that unlocked something in me. I haven't missed brushing my teeth twice a day in years, and I floss at least 5 days a week, usually 7. I get compliments at the dentist now, and it feels so validating. A total of 5 minutes of my day to keep my teeth as long as I can is worth it.
The same thing happened to me, though not quite as severe. My significant other goes for his checkups every 6 months, religiously. He told me to go as well. I insisted everything was fine, since I had no pain, and I'm very good with my oral hygiene. Eventually, I got an earache. I saw my own general practitioner twice, and went to a primary care clinic as well. No one could find any issues with my ears except redness and swelling. I was given a course of cortisone twice, and some ear drops. My mom listened to me complain and suggested I see the dentist as a last-ditch effort. They did x-rays. It turned out to be cavities developing on all my back molars, above and below, both sides. When I was around 12, my dentist at the time saw discoloration on the surface of my molars and just recommended to my mom, keep an eye on them. I'm still not sure if I should be grateful or upset with her.
Story 18. I would see a light flash across my eye every 2 minutes. It wasn't too annoying. I looked it up and saw that it could be a detached retina. I reassured myself it was not a big deal and put off going to the doctor. It turned out to be exactly that, and the reattachment surgery didn't go well. Now I can only see out of one eye.
This happened to my dad and his father. Apparently, it can be genetic, especially to sons, so just remind them to go to the eye doctor annually if you have any. My doctor said if you catch them early, it's generally fixable.
My dad had a retinal detachment, and I actually see the same eye doctor he used to. She told me in no uncertain terms that if I ever even suspect there's something wrong, to contact her immediately. Better safe than sorry.
The only reason this didn't happen to me is that my optometrist happened to mention that the risk is higher if you're short-sighted. I should look out for flashing lights in the eye. And if the detachment is worse, a dark curtain across the eye. I got flashing lights one evening that went on into the night. Completely painless gone by morning. If I hadn't been warned, I would have thought that was weird, but oh well, it's gone now, and thought no more about it. Instead, I had the slight detachment fixed by laser the next day, and it saved the sight in that eye.
Story 19. Acid reflux turned into severe GERD, gastroesophageal reflux disease. I stopped eating a lot because it was so bad, and then I became malnourished, which made everything way worse and brought out my other health issues even more. If you're dealing with reflux instead of PPIs and antacids, PPIs are proton pump inhibitors, try a reflux diet first. Could save you a lot of pain down the road. Also, if you have reflux, you might think not eating helps, but it actually makes it worse. You just need non-acidic foods.
I will have my fundoplication operation in April, so I'm really hopeful the reflux will be gone after that. Very sorry for you. It's the most frustrating thing when no one believes you or takes you seriously, especially as a woman. I also fought for a few years until I got diagnosed with the hernia, as every doctor just tells you to take pills or change your diet. My body didn't tolerate any pills, and the diet wasn't really helping. Where are you from? Because here in Germany and Austria as well, this operation is a standard method to treat a hernia or heavy reflux, and it's done very frequently in hospitals with a high success rate. I will have the toupee fundoplication. Maybe it's a different one your doctor was talking about. Wish you all the best and health.
I developed gastroesophageal reflux disease, or GERD, because of my severe anxiety. It was such a difficult journey figuring out what kind of treatment works best. Some days I'm still in denial that my GERD spikes are connected to my generalized anxiety disorder, or GAD. Puking, acidity, stomach pain, and anxiety is the worst combination of all time.
I have short Barrett syndrome, and I'm battling malnutrition. GERD, or gastroesophageal reflux disease, really sucks. Sometimes it gets so bad you don't know if it's reflux or cardiac pain. It's a shit show.
Story 20. About 15 years ago, I came down with a bad case of norovirus. After I stopped puking and shitting, I never really recovered my appetite. I would struggle to eat, but was constantly thirsty. I ended up dropping down to about 50 kilograms over the following 6 months. I couldn't sit down for long periods as I was so bony it would hurt. I spent all my free time, and usually my 1-hour lunch break, sleeping as I was so exhausted. Eventually, I collapsed at work and was rushed to the hospital. Blood glucose was 30 millimoles, or about 540 milligrams per deciliter. Turns out I'd developed adult-onset type 1 diabetes.
Dang, I didn't even know you could get type 1 as an adult. I had norovirus too. Fucking traumatizing.
Story 21. Dental stuff. Take care of your teeth before they become real problems. You'll save a lot of money and a lot of pain.
My 40s were pretty good in a lot of ways, but they also included dental expenses. Years of smoking and neglect had caught up with me, and it did not look like things were going to improve at all. Money was spent on a few surgeries and dental cleanings every 2 months for a long time. It had to be about 8 years later when the hygienist told me things were rebounding. My gum pockets were not getting worse. They were improving greatly. Still all messed up in some ways. My advice, picks. People say floss, but a lot of us just aren't going to do it, especially more than once a day. I always have picks in my pocket and use 5 to 6 a day. Get those particles out of there.
Story 22. Being anemic and never doing anything about it. I passed out and realized it's serious. I need to be seen.
This is me. My iron deficiency was so horrible that one morning I woke up and couldn't move an inch without feeling like I was drunk and on a carnival ride at the same time. I couldn't walk a straight line. I couldn't lie down to sleep. I couldn't turn my head without my entire world spinning. It was unbearable. I passed out and vomited multiple times, and this went on for days until I finally got someone to take me to the emergency room. I thought I was dying. They ran their standard complete blood count and human chorionic gonadotropin panels, and there was nothing abnormal. They chalked it up to anxiety. I finally went to see my obstetrician, and she ran an iron panel. My ferritin level was at 1, ideally supposed to be 70 to 100 nanograms per milliliter. I had symptoms before the intense dizzy spells, but I didn't do much about it as I could still function decently. So I put on the back burner, especially since I have young children. I struggled with tachycardia, shortness of breath, restless legs, severe fatigue, brain fog, migraines, and so on. These symptoms still pop up on occasion if I don't keep up on my iron infusions and oral iron supplements. Anyway, friends, ladies especially, keep an eye on your iron levels.
My 24-year-old daughter had the exact same symptoms. She couldn't stand up quickly without feeling like she was about to pass out. Severe fatigue, vomiting, dark spots and flashing in her eyes, rapid heartbeat. She went for iron infusions and took iron pills. Nothing helped. Then one afternoon, she developed awful pain in her left side, so she drove herself to the local emergency room. The physician there pretty much told her, "Listen, you just had a baby 8 weeks ago. You're healing. That's why you're hurting so bad." She damn well knew the pain wasn't related to childbirth. This was something else. After 4 hours of them trying antacids and Advil to no avail, they finally gave in and told her, "We'll give you a CT scan, but just so you know, if it shows nothing, there's a good chance your insurance will refuse to pay, and you'll be forced to pay it in full." Which is bullshit, by the way. But whatever. My daughter had a 2.5 centimeter tumor on her left kidney. She had stage 2 renal clear cell carcinoma at 24 years old. Completely unheard of in such a young female. 6 months later, they removed her kidney. Listen to your body. Always.
Same. I knew I was anemic, but couldn't be bothered to make an appointment, so I left it. I started to get quite bad tinnitus and strong cravings for things I shouldn't eat, and cravings for smells, especially mechanical smells like cars, tires, and oil. I guess it was pica. I went to the doctors, and my ferritin was so low, they sent me for a colonoscopy, an endoscopy, and an MRI to check for internal bleeding.
Story 23. Really heavy and painful periods, which all of my doctors over the past 15 years told me were normal. One morning, I woke up vomiting from severe abdominal pain. It turns out it was an ovarian chocolate cyst rupture, 8 centimeters, which led to sepsis. I spent 3 weeks in the hospital's high acuity unit. It should have been the ICU, the intensive care unit too, but it was full. Diagnosis: endometriosis.
Doctors, your whole period should only be a couple of teaspoons. Also doctors, yeah, your golf ball sized blood clots and bleeding through a super tampon in an hour is totally normal.
Yep, same here. Except mine caused torsion and was septic. Being immediately taken back into a busy emergency room was not on my bingo card that day. Nor was my obstetrician pushing me up to surgery herself, because no nurses were available and kept her and me waiting for the surgery I needed now. Good times as a woman. Being told my whole life that not being able to walk during my period was silly and that I was just intolerant to pain. It turns out my pain tolerance is actually insane, and I was just forced to live with it until my mid-20s when the torsion happened. Not having periods because of continuous oral birth control is a dang godsend.
I had the same symptoms and the same size chocolate cyst. Fortunately, I had it removed before it ruptured, thanks to my gynecologist doing his job properly. It makes me so happy to see the rise of awareness about endometriosis nowadays. Hopefully, the next generation of girls will be helped instead of told some bullshit about how it's part of being a woman.
Story 24. Anyone else just kind of ignore weird heart palpitations until they become a full-blown anxiety spiral? Just me? Okay.
I did that for a while. It turned out to be severe hyperthyroidism. It could have killed me.
Stress, caffeine, electrolyte imbalances, and nicotine can cause palpitations, among other things. I get them when it feels like gas bubbles are stuck at the top of my stomach before I can burp. They're usually benign, but they can turn into ventricular tachycardia if they get too frequent.
My heart flutters sometimes when I'm in bed going to sleep. It's the only time it does it. I have high blood pressure and have taken medications for years to control it. My blood pressure is fine at every doctor's visit, and they even checked my heart and said it's fine. I figure I'll just have a heart attack one night.
Story 25. I have plantar fasciitis. I honestly thought my feet just hurt because I am fat. Turns out I have some killer calcaneal spurs, and now I limp when I walk because I'm in constant pain. I also didn't know this was an issue, but apparently I've been hyperflexing my knees my entire life, and so now they suck. Have you ever had to consciously think and adjust how you are standing or walking? It's exhausting and feels so unnatural.
Plantar fasciitis is insanely painful. Do your best not to get a retail job with plantar fasciitis, especially in concrete floor buildings. Groan Zoof.
Try shockwave therapy. It was a miracle cure for my plantar fasciitis.
Oh, don't worry. This hasn't stopped me from working. It's all the other things wrong with my body that have me laughing my ass off. Chuckles, but seriously, yes, it hurts like hell. I feel so unsteady on my feet, and I've had to use a cane from time to time. I'm only 26. Fuck my life. My body just doesn't like being a functioning body. It isn't even the only thing wrong with just my feet.
Story 26. I'm about 50 and I've had an anxiety and depression diagnosis since my 20s. Panic attacks, long periods where I just couldn't get out of bed, couldn't hold jobs or have a social life, and so on. I've seen so many therapists and doctors, and there were always mysterious physical symptoms like migraines and chronic gastric distress that no one could explain. Got a new therapist in my late 40s, spent 2 years telling her everything I told everyone else since I could remember, and she lined it all up and got me my ADHD diagnosis. Relieved that was it. I'm autistic and have ADHD. Generation X women got so screwed over when it comes to having neurodivergence diagnosed.
Yep. Anxiety and depression went down 70 to 90% after I got on ADHD meds. Crazy. It wasn't me this whole time.
Story 27. Gallbladder. It was such awful pain. Then once it passed, it was so easy to forget about it. Finally, I had such a severe attack that by the time they got it out, it was about to burst. It was stuck to my liver. Anyway, I then learned that a large number, I can't remember the exact figure, of people die each year from a burst gallbladder.
This is the third time gallstones have popped up. This whole thread is making me so happy that I have an appointment with a surgeon on Thursday to get mine removed soon.
Mine turned gangrene. Genes, diet, poverty. That's the theory.
Story 28. Attention Deficit Hyperactivity Disorder. I thought it would be too hard to get a diagnosis since I'm a woman with the inattentive type, and I'd always heard they have to interview your family. I knew my parents wouldn't be helpful whatsoever unless they picked up that my parents are also highly neurodivergent. My primary care doctor sent me to see the psychologist in her office about my anxiety, and about 10 minutes into the conversation, she clocked it and, unprompted, asked if I've ever been evaluated for ADHD. She had me fill out a questionnaire and boom, diagnosed. It took until the age of 31 to figure out what was wrong with me, but taking medication for it has been so life-changing.
I was 52. Menopause put me over the edge, and my coping mechanisms stopped working. I started medication last week.
I was diagnosed at age 39, and it's been life-changing to say the least. It's the fun attention deficit hyperactivity disorder, though, because it comes with a side of anxiety. But thankfully, I'm on some really helpful medication.
Same. I was diagnosed at age 50, 2 years into menopause.
Story 29. I lost 45 pounds without dieting. I was drinking water nonstop, just insanely thirsty, constantly. Turns out it was diabetes.
I am 44 years old, and I still remember reading a book about diabetes in elementary school. The main symptom they talked about was constant thirst. So, if I hear anyone say they're always thirsty, I think back to that book and tell them it could be diabetes and to get checked as soon as possible.
You often do once you start treatment with insulin. But if you aren't treating your diabetes, then the sugar in your blood isn't being used by your body fully, or at all. Instead, your kidneys have to filter it out to be urinated, which wrecks them. Thus, weight loss.
I always thought people gained weight when they were diabetic.
Story 30. One random morning, I felt pain in my left middle finger. I figured I probably injured it somehow and ignored it. That winter, I had cold sensitivity along with the pain in that very spot. I still ignored it. Gradually, the pain and cold sensitivity got worse until I had to wear gloves at home every day, even during summer. I decided to get it checked out, but every test came back negative. Only my ANA anti-nuclear antibody test came back low positive. My doctor thought it was scleroderma and Raynaud's despite the pain only being in one finger, so he put me on steroids and immunosuppressants. Nothing worked. The pain and cold sensitivity remained. I went to a different hospital for a second opinion. They did an MRI, a magnetic resonance imaging scan, and found a glomus tumor in that exact spot. No one thought to look for it earlier because the tumor was in an unconventional part of my finger, not the nail bed like it typically is. I had minor surgery, and this issue, which I had been suffering from and getting worse for more than 1.5 years, got fixed within a day. Relieved regarding the ANA, apparently it's common for women below 40 to have a low positive result, and it's not a red flag until they test positive for any specific autoimmune condition. Story 31. Dizziness. I've had it as long as I can remember. It's just part of my daily life. Recently, I fainted and had a really bad fall, injuring myself and my child. Now, I'm getting a bunch of tests done to find out what's wrong with me.
Ditto. I've been dizzy, seeing black spots, or straight up fainting since I was a child, despite being extremely active and otherwise healthy. During the pandemic, I finally fell down a flight of stairs and severely broke my ankle in a few spots and tore anything that could tear. For what it's worth, after a bagillion tests, I'm now being treated for POTS, postural orthostatic tachycardia syndrome, and am on a wait list to see a team specialized in FND, functional neurological disorder. FND seems to be a controversial diagnosis, but I figure I've got nothing to lose at this point. Everything else except POTS has been ruled out. I have nothing to lose because I don't live in the US, so it will cost me nothing except time, which I have tons of since I can't work anymore.
FNS is a bullshit diagnosis. Doctors give it because they can't figure out what's wrong. It's the modern version of diagnosing hysteria.
Dizziness is a part of my everyday life, too. It has been for the last 12 years. It started randomly one morning when the sun was shining through my window. I honestly felt like I was having what I assumed a seizure would feel like. I crawled to my roommate, ironically now my husband, and begged him to take me to urgent care. I haven't had an incident like that in years, but bright lights are still a trigger for me when it comes to dizziness. I also have hemiplegic migraines, so maybe they're connected somehow, but my magnetic resonance imaging scans have always come back fine.
Story 32. I had 2 to 3 bowel movements a day for around a year. Real straining stuff. I chalked it up to a messed up gut microbiome or an awful diet. One day I pooped a blood clot and finally decided to go to the doctor. Turns out it was celiac disease. Story 33. I had tingling in my pinky finger and the one next to it. It eventually spread to my other fingers. One day, I woke up to find my entire hand paralyzed. I spent 4 days in the hospital. They eventually found out I had radial nerve palsy. My hand was 100% paralyzed for 6 months. I went through extensive physical therapy, and after about 6 months, I started to get some feeling back. Took over a year to get my feeling back. Story 34. For months after my daughter was born, when I'd shave my legs, the sensation felt dull. I was a new mom, just back to work with a long commute, so I just ignored it. I woke up on my birthday with tingling in both legs below the knee that moved up every day until I could only shuffle along. I went to the doctor, who sent me to the emergency department. It was multiple sclerosis. I got steroids and the right medications, so I completely recovered the use of my legs and live a normal life despite the multiple sclerosis. Story 35. Frequent urination symptoms that come and go. Turns out I had a uterine fibroid large enough that it made things inside my lower abdomen crowded, so it started affecting my bladder and stomach acids. The latter made me feel always full, burpy, and sporting a pregnant-like tummy. All along I thought it was just belly fat. By the way, the doctors also discovered a malignant growth in my left ovary, which needed to be removed along with the fibroid. I don't know if the fibroid pain I experienced before I finally hauled myself to the emergency room was luck, because it made the discovery of the ovarian growth easier, as it was also caught during my ultrasound. My cancer was caught early at stage 2B. The cancer cells didn't spread and only settled on my bladder's outer covering. And now I just got done with my first chemotherapy session last weekend. On to 5 more in the coming weeks. Ironically, the side effects of my chemotherapy were similar to my first symptoms. Frequent urination with more burning sensation this time. Story 36. Maybe not a super long time, but all of 2025, I thought I was aging really poorly. The left side of my face just kept losing its puffiness, and I looked like a dog. My left eye looked like it was coming downwards. I went to the gynecologist in August and asked if she thought I was aging normally, given that in January I looked fine. She looked at me like I was stupid and told me, "Girl, you're in your 30s. Tough shit." Well, it turns out I have a rare pathology called silent sinus syndrome. My maxillary sinus collapsed, the bones remodeled, there's a dent in my midface, and my orbit is being sucked downwards. I'm permanently disfigured and risking permanent double vision. I'm a 32-year-old woman and recently single. No family or support system. It's over for me. Exasperated sigh. Oh, and of course insurance doesn't want to cover surgery that stops the progression. Benign pathology. My fucking ass. Story 37. Cracked tooth. I've had bad teeth for a while, and there was one in the back corner that basically cracked a piece off. But it didn't hurt and didn't cause any immediate issues. 5 years later, it got an infection, caused headaches and all sorts of other issues, so I had to have it pulled out. A couple years later, I went for a checkup, and the same tooth on the other side needed a filling. I didn't have the money to pay for it, but again, no pain. A couple years later, those headaches and stuff came back. But on the other side, this time, though, my body or brain subconsciously couldn't handle the anesthetic for the dentist to just pull it out. So I had to go through a series of appointments over a year, starting with a basic tooth pull, then being put under nitrous, and eventually needing a full-on general anesthetic surgery to have it pulled.
Do it. I lived with my cracked tooth for too long. I finally saw my dentist when I couldn't take the pain anymore, but I had to wait 10 days before I could get a consultation with an oral surgeon. Within a few days, it turned into an abscess, and I quickly went septic. I ended up in the hospital. So much pain, time, and money, all because I was dragging my feet. That cracked tooth could have killed me.
Story 38. Chronic constipation. By the time I reported anything to my doctor, I was septic, and my entire colon was necrotic. I lost my entire colon and lived with an ileostomy for 6 months. So yeah, if you can't poop, tell your doctor. Story 39, Ehlers-Danlos syndrome. I would dislocate joints, slip them back in, and continue on with my life. Now I'm 40 years old, with knees and shoulders that have a lot of scar tissue and built-up injuries. But because my range of motion is so much more than average, surgery often isn't an option. As an example, I recently tore the labrum in my left shoulder. I showed the doctor how the range of motion in my left shoulder compared to the right. He assumed the right shoulder was the injured one because the left stopped at a normal range and the right kept going. The normal range in the left arm was actually the reduced range.